Welcome back to GoLocal Live here in the Navigate Credit Union Broadcast Center. We're joined now by Stephen Hourahan. He is the Executive Director of AIDS Project Rhode Island. Thanks so much for joining us.
Thanks so much, Rachel. Thanks for having me.
So tell us a little bit about, there's been a lot of buzz lately in the national media about the use of using HIV medication preventatively to help prevent transmission. And of course, this is just research and it's in its early stages, but tell us a little bit about what's going on.
Oh, it's actually pretty exciting. We have the ability now to really say that if you are HIV positive and if you are on medication and you are undetectable, that you cannot transmit the virus, which means that, and the whole campaign is called U equals U, undetectable equals untransmittable. It was brought out last week in Amsterdam at the International AIDS Conference. They talked about the fact that they've done 87,000 individual sex acts with 2 people, one being positive, one being negative, and no one has become infected. So it's a very, very positive thing. So it's great news for there. And then the other thing that's been in the news a lot, and we talk about, and something that I think your viewers might be interested in, is PrEP. And PrEP is a 1 time a day pill that will ultimately make you immune to HIV. You take it, you stay on it, and if you are engaged in a risky behavior, having sexual intercourse or having sex with someone who is positive, the chances of you becoming positive are reduced to 99%. There's no chance of really getting HIV.
Wow, these are incredible strides we've made in just a few decades.
We have, and the big news with the U equals U is that our goal at AIDS Project Rhode Island and across the country with all the AIDS organizations, our goal is to make sure that we send the message out there to reduce stigma and to hopefully have people who are HIV positive to get out, to get tested, to stay on their meds and know that their life is not over, especially their sex life is not over because they're HIV positive. They can continue to engage, they can have a healthy sex life, and they're not going to be infecting anyone.
Of course, so a big piece of this is education then, to make sure people get tested and to know that there are options. It's not the death sentence it was 10, 20 years ago.
Exactly. And the best part about this is that we have, first of all, at APRI, we are now have very serious programs that are doing things around treatment. We work very closely with everybody in the state of Rhode Island who's HIV positive, but we also have invested a great deal in a mobile testing van to be out in the community, talking to people, getting out around at all the colleges. We're out in the community at places where we know people who have men who have sex with men meet, and we basically engage where people are. We also have people on our staff who spend their time working on the apps and where people meet, on Tinder, on Bumble, on Grindr, all of the apps where people might potentially be exposed, and we can actually get them in to be tested and make sure that they understand what their status is, and if they're positive, get them on meds so they can become untransmittable.
And so who would you recommend for both testing and for use of these preventative measures?
Well, anybody who's sexually active, basically, is at risk. The highest risk, though, is unfortunately among men who have sex with men, and the largest group of population that really is at risk is with Latino men and African American men. And we know that you have greater risk of being HIV positive because of the access to health care, the poverty issues, and also just the fact that people who are not really aware of the testing and have not been tested in their lives. So the answer for what I would say for everyone is that if you're sexually active, heterosexually or homosexually, you basically should be thinking about having a test at least once a year, making sure that you know your status, talk about your status with your partner when you meet someone, ask the question, are you positive? Have you had a test? When's the last time you had a test? And then make sure that you check for STDs continually. And use condoms, which is something that we give away a lot of condoms. We still encourage condom use, and we know that all of this, the meds and everything help, but ultimately it doesn't work for us to have a very to take condoms out of the equation.
So these people considered in high risk categories, these are the ones that we'd recommend the medication to. And is the FDA testing it? When will it become?
It's all approved. It's been out there. It's been approved for years, and it's a drug that was used as part of the gay AIDS cocktail. So when the AIDS cocktail was being done back, and it was approved in 2012 for individual use, we have a full-on program with the manufacturer, who's called Gilead, It's a very expensive drug. We know I think it's too expensive, speaking for myself and for AIDS Project Rhode Island. We believe that it's way too expensive. It's about $1,400 a month.
Wow.
And, but they have assistance programs to pay for it, and they also have assistance programs for the copay. So if you have insurance and you have the ability to get on the drug, it's something we highly recommend. We work very closely with the Miriam Hospital and Dr. Phil Chan and his team there. So if someone wants it, APRI is the place where you can come. It's aidsprojectri.org, and you can basically make an appointment to come in, get tested. If you want to get on PrEP, we will walk you to the Miriam and make sure that you have everything you need to get the test.
And so what kind of ramifications might this have in other lesser developed countries where there's less education and less access to healthcare, places like Africa where HIV cases are exploding?
It's a huge undertaking, and basically we think of it, it's life-saving. And there's been a lot of discussions. The cost is the biggest issue, but because we have the opportunity as a nation and as an organization for APRI and a part of the national AIDS world, we are really pushing to make sure that people are aware of it, and we know that we can stop people from becoming infected and ultimately stop the spread of HIV. HIV is a preventable disease. We know it is, and ultimately our goal at APRI is to stop it, and basically so that we can close up shop and go home.
So do you think that's something that could come in the coming decades? Do you see
yes,
that as...
I do see it. I do see it as something. I think that the more advances we have, there are discussions around vaccines, there are discussions around opportunities for, if we can destigmatize the HIV piece and get U equals U and people understanding that, it's a very important thing. And then also just the idea of really making sure that college-age people get used to testing. 20 years ago, people saw people with AIDS, they understood the dangers of it, and people were dying from it. Now, the reality is that we have a situation where they don't see it on the front page of the paper, they don't see movies, they don't see plays, they don't see it in popular culture, so it's sort of gone behind the scenes, but ultimately people are still infected, still getting infected, and also people still are feeling the effects of the disease.
And here in Rhode Island, are cases on the decline?
Unfortunately, we've had an increase in the number of new cases. Overall, people are living longer, which is great, and we have a huge group of people from who have been positive for more than 20 years in a lot of ways. So one of our major goals is to make sure that we deal with the long-term care of people with HIV and make sure that they have the health care, they have the housing, they have the things that they need, and also the reality is trying to find doctors, trying to find nursing homes, all of those things as you age. It's all part of a process that as an agency we're at the leading edge of, and trying to make sure that people get what they need.
Great. And do you think, especially here in Rhode Island, do you think public schools need to educate students more?
Of course, yeah, we actually speak in schools. We have speakers that go out, and you can find out about that at aidsprojectri.org. Teachers, we go into schools anywhere from grammar schools and middle schools right on up. When health education is taught, it should be taught, be part of the curriculum. And we also know that people who at the college level, when we go out and speak about healthy relationships and how to engage in a conversation about HIV, we do all of that with a really talented group of men and women who are testers and who are part of that team. It's really exciting that I think that, and I would not be, our goal is to have a very, very reduced number of people in the state of Rhode Island who are HIV positive, and the number of people who are finding out that they're positive.
And it seems like it's more and more possible with all of these.
And thank you for the opportunity to talk about it. Get out on your airwaves. I'm out all the time. Our team is out daily making sure that people understand what's going on.
Great. Well, thanks for taking the time to come in and speak with us,
Rachel.
Break down all of the new things that are happening.
My pleasure, totally.
Great.
Thanks.
Well, thank you so much for joining us. We really appreciate it.
You bet.
And we'll be back in just a couple minutes with our last guest of today.